One. Welcome back to the show, everyone. Today we're diving into the intersection of radical longevity and artificial intelligence. My guest is a recovering entrepreneur and a self-described disruption bigot who spent years studying under the man who literally coined the term disruptive innovation, Clay Christensen. He's held the reins at Deloitte as a managing director for the future of health and pioneered the quantified skin category long before biohacking was a buzzword. Now he's on a mission to help humanity break the 100-year ceiling. He's the founder and CEO of Live 150.ai. Please welcome to the show, Rahul Mehendale. How are you doing, Rahul?
Hey, Sunny, thanks a lot. Thanks for having me. Doing great, traveling internationally. It's definitely impacting my live longer genes because of jet lag.
I bet, I bet. So I guess we're gonna get into Live 150. And by the way, longevity is one of my favorite topics. I had the good fortune of getting to hear Aubrey de Grey many years ago. Big fan of The Singularity is Near, read all of, obviously Raymond Kurzweil's books. I'm super pumped to get into this. And then AI, obviously, right? So, but before we do, I like to capture people's kind of background, right? So if I'm not mistaken, I think you grew up in Pune, India, right? And you eventually earned an MBA with a distinction from Harvard. And you've also mentioned kind of the yin and yang of life and the belief that success and struggle coexist. So, how did that upbringing instill the philosophy of, always taking the hard path? And how does that shape how you build companies today?
Wow, that's a great first loaded question. So let me start off with success and struggle. And just this morning, I had a bunch of entrepreneurs who were meeting with me, and we were talking about AI and health, and how I think the future is going to lay out. Because I'm really passionate about driving change and creating value for people. So first of all, that's been my philosophy. That's been influenced by my upbringing. That do things that shape and move the needle on humanity. So whether it's having people live longer, whether it's having people live healthier, whether it's having people live better, across any front, create value that brings value to society in a way. So that's been part of my upbringing that really influences me, and that has instilled a philosophy in terms of what to do. So I'm not the kind of guy who also wants to do what I call uh, sell another widget. From a philosophy perspective, I also want to always travel the path less traveled, or rather, I want to walk the path less traveled. Um, and that's helped me shape the companies and the opportunities that I pursue. So, for example, with my skin, when we were the first ones to figure out how to quantify skin health, I realized that nobody had really cracked the code on measuring skin health. And skin's our largest organ, right? So if you used, or one of your listeners uses a moisturizer, and I were to ask them, hey, how much moisture is good for your skin? Not just they, but even a dermatologist would probably get stumped. And this was in 2006, 2007. And I said, you know what? Wait a minute. Somebody's missed the largest organ of the body, right? So you wouldn't take insulin if you didn't know your sugar levels. You wouldn't take statins if you didn't know your cholesterol levels.
Hmm.
Well, but you're applying all sorts of product to your skin, which is a living organ, expecting a certain outcome without even knowing what is healthy skin, right? So I like to pursue these opportunities which are forgotten by people, which have been overlooked, and are in areas that people really care about. And right now, I'm doing Live 150, so I'm leading Live 150. Again, how much longevity is good for you, or do people want? And it's infinite. But it's not just about longevity. What scares people is it's not that I just want to live longer. It's not just lifespan. More importantly, it's about health span. And you're seeing what's happening, whether it's with Brian Johnson, whether it's David Sinclair, whether it's Peter Attia, you're seeing Jeff Bezos. I mean, everybody. I don't know if you caught that little blurb where Xi, Putin, and Kim Jong Un. I mean, even the triad, which has got a bad rep. What did press cover they were talking about? They were talking about how to live to 150. So there you go. Everybody across the world is unified in trying to figure out how do we extend lifespan, and not just lifespan, but also how do we extend health span, because we don't just want a long life by living on drugs and tubes and all sorts of things. We want a long life with a long healthy span where we stay away from any comorbidities and disease. So that's really shaped both the companies that I've built. Live 150 right now, where we are pursuing a problem that's again incredibly difficult, because people have tried to solve different parts of this equation, whether it's Apple Watch tracking history, whether it's diet apps, whether it's Google's Fitbit, whether it's Peloton. I mean, each one has been solving for a particular silo, and nobody's really integrated this to give you forward-looking guidance in terms of what should I really do to increase my lifespan and my health span. What should I eat? What should I work out? What should how should I sleep better? How should I have the best mental health? So nobody's giving you forward-looking guidance, and it's an incredibly hard problem. So again, it's been kind of forgotten by all these players who only track history. And so I gravitate to these opportunities, which are forward-looking and which really add value to society and to people. And that really excites me when it's on a path that's less traveled. So that shapes the companies I built, and the yin and yang of life, because I always say success and struggle coexist, right? And it's difficult. These paths are incredibly difficult because you don't have a playbook that you can copy from, where you can say, oh, somebody else solved the skincare problem. Oh, somebody else has solved this, this extending lifespan and extending health span problem. And we have figured out how to drive behavioral change. So we don't really have a playbook that we can mimic. We have lots of lessons learned anecdotally in the environment, but we don't really have that playbook. And so success and struggle coexist because you're constantly failing as you're trying to figure out what works. So for every 9 failures, if you're lucky, for every 9 failures, you have one success. And that's where the yin and yang of life come together, because you have success and struggle coexisting at each time. So the struggle, the failures, they actually move you closer to success than anything else. And that's another philosophy, personal philosophy, that shaped how I think through these opportunities.
So you studied under the legendary Clay Christensen, is that correct?
Yes, that's
Uh,
right. I mean,
so he's the
Clay's
guy who coined the term, right? Disruptive innovation?
yes, disruptive
The
technology, but
disruptive
disruptive
technology.
innovation. Yeah, yeah,
And then
and he would
you
always tell me, he's like if there were one thing he would change, he would he would not have called it disruptive technology, because then people thought that it's something about some sort of a technical piece.
mm,
Yes, but I was incredibly fortunate and lucky, not just to learn under Clay, but also have won his friendship and have his mentorship. I mean, he was
mm.
instrumental in helping shape my thought process.
And I guess you call yourself a disruption bigot, right? So what's the single most important lesson he taught you about why big systems fail and how you're applying it, to the healthcare industry?
Yeah, so I mean, the single most important lesson he's taught me is when people get on the path, and especially large players, when they get on your big systems, as you said, right? As they start focusing on innovation, they start overshooting the needs of the market. So what happens is they look at their highest paying, most affluent, most demanding customer, right? So in the airline world, is the first class passenger. In the apparel world, it was Neiman Marcus's and Nordstrom's customers. So what do they want? They want this high-end, whatever jewelry. They want like high-end brands, which they want white t-shirts, which cost $700, and they need a concierge. And when you walk in, you need champagne, right? Now, what happens is as you innovate, specifically focused on your most attractive customer, you start overshooting the needs of the mass market. So people are, I mean, I'm really happy if I walk into a store and they give me a glass of, I'm not an alcohol drinker, but anything else, right? But I'm not the kind of guy who's going to pay for that. So what happens is people are happy with these innovations, but they're just not willing to pay for it, right? And we've seen this happen again and again across the spectrum. You've already heard me talk about Neiman Marcus. I mean, there you go, overshot the needs of the marketplace, right? So what happens is as these big systems innovate by taking in by only focusing on their highest end, highest paying, highest demanding customer, they overshoot the needs of the mass market. And that creates an opportunities for new entrants to come in. And that's where the Ryanairs of the world, or the JetBlues of the world, or the Southwest of the world, they come in and they don't have these fancy reservation systems, and then they don't have these fancy meals in the aircraft. They don't have these fancy, experiences which they give, and people are really happy. And it's happened with airlines, it's happened with Walmart and Sears and now Neiman Marcus, it's happened with Toyota when they went after the Fords and the GMs of the world. So they all start off with basic low-end product, and then they start innovating up and disrupting the incumbents. And disrupting doesn't mean that they kill the incumbents. That does happen too. But what happens is growth goes away for the incumbents. So what happens is these big systems, suddenly their growth evaporates, right? So that's a lesson that's really stayed with me from Clay. And so every time, as you call me a disruption bigot, I mean, I love it. As I said, I'm a self-proclaimed disruption bigot because I'm always looking at things and I'm saying, is this an overshoot? What's the opportunity where we can start with a low-end product or a service or whatever it is? And then what is the opportunity to innovate, to steal growth from these big players? And so I'm looking at it from a standpoint of healthcare, right? I mean, the funny thing about healthcare is it's neither health nor care. It's all about sickness. So if you notice the entire ecosystem, whether it's pharma, whether it's hospitals, whether it's physicians, whether it's the whether it's the insurance players, they actually all make their money from sick people. They don't care about us being healthy. We are forgotten. If you're healthy, I'm healthy, your listeners are healthy, nobody cares a damn about you because they don't make any money from you. So what do? They go after innovating, after looking at sick people. So let me do more concierge medicine. Let me do more diagnostics. Let me do, more advanced surgeries, blah, blah, blah. Nobody's really addressing the needs that, hey, how do I get you back into health and how do I keep you healthy?
So,
And so you
so
are seeing the
yeah, sorry,
same
Rahul.
trend in the world of health. Sorry, go ahead.
So I was gonna say, so let's maybe double click on your, I guess, personal crisis. You talked about how the moment everything changed, right? You used your own AI platform to reverse high cholesterol. I mean, and lower your blood pressure and lose weight. How? What?
Yeah,
Like, what's
absolutely.
the story behind that?
Yeah, so I mean, my own. So I was at Deloitte, and I'd done startups. I mean, highly stressful, right? This is the yin and yang. It's the highs are incredibly high, and the lows are incredibly low, and the standard distribution is, the variance is tremendous, and that it's like a roller coaster, right? So my cholesterol had gone up, my blood pressure went up, and year one, so I do an annual test, physical, and it was really interesting that 2021 or 2021, only one metric, my cholesterol was bad. And in the world of health, if you disregard that, things start getting exponentially worse. So in 2022, my blood pressure had gone bad, my cholesterol had gotten worse, my sodium levels had gone bad, my sleep patterns had changed. So suddenly there were five things on my health metric which had gone bad. And it made me pause and I said, whoa, wait a minute. Nobody's really, and the doctors were really happy to prescribe statins to me. They were really happy to, again, I was in the world of sick. There was no care, right? And I realized, if I need to take control of my health, I need to take control of my health. I need to get healthy because the system doesn't care about having me healthy. They want to do symptomatic treatments, which is they don't want to cure me, they just want to manage my symptoms. So cholesterol, okay, I'll drive it down, stay on a pill for the rest of your life, you're okay. Blood pressure, take another pill for that. And we're not going to address your root cause, right? So in my own personal life, I realized that the only way to make a change is to focus on four things: nutrition, activity, mindfulness, and sleep. But then I had to hack my way into figuring out what would work for me. And in the process, I lost about 8.5 pounds. So I got healthy. I was vegetarian. I don't give up on alcohol. I did a whole series of small changes. I started working out, aggressively every day, like an hour. I was adding cardio and weights, and I was doing everything from a nutrition perspective. I'd stopped eating late. I was not eating as much sugar, or if I had my sugars, then I would have them in the morning, pretty much before at lunch or before lunch. So I did all these little changes. I didn't do anything very major at one time. It wasn't like, it was small improvements that were sustainable. And so I did that, and literally in a year, my entire health metrics changed to the point where my physician, when I went back in 2022, and I went to her, she looked at me and she said, "What are you doing? Are you running like a marathon every other month?" Or she said, all my metrics were at an endurance athlete level. These were the exact words she used. And if you think it was just me, my entire team has the exact same passions about health, and they have all gone through very similar changes. We are all a bunch of people who are nuts when it comes to let's help scale our insights and our knowledge to make a difference to society and to people. And I've had people, on my team who have lost 50 pounds. They're running marathons. They're sleeping better. They're eating better. Their metrics, they're off all meds. At an average, we have lost, at an average, we have lost about 5.5 pounds in 8 weeks. And when
So
you lose weight, why am I talking about
what's
weight? And that
happening?
is
Like,
not,
is this a function of your Live 150? Like, what
yes,
can you expand a bit? Like, what? And you touched on. So my wife just started wearing one of those rings, those sleep rings. Those four things you talked about, I would say are near and dear to my heart. I think, yeah, I would say those are the four big unlocks. But can you double click a little bit on like, so what is your company doing, and is it an LLM that you just interface with? Does it plug into all these devices, and is there a dashboard? I'm so curious. Yeah, so maybe if you can share a bit more.
sure. So Live 150, I mean, as you introduced, our whole goal is to get people to live longer. And we believe that 150 is escape velocity, right? So if you add up all the innovations, around CRISPR, genetic editing, the drugs that are in the pipeline, as you think about a lot of the different changes that are being planned, you pretty much, the generation that's born today should pretty much be able to live very easily around 125 to 130. Now you add certain components from a lifestyle perspective in advance. And then we believe that with organ regeneration, with all these innovations, you hit the escape velocity, which is at 150. So our goal is to get people to live long and live healthy. It's not just live long, but also live healthy. And so how do we do that? So first thing is, you talked about your wife having probably an Aura ring or a Whoop band, or, I have all these tools, but they all track history. Like your Apple Watch or your Fitbit, it'll tell you how many calories you burn. But it's not telling you, Sonny, for your health, I need you to do this workout for 15 minutes tomorrow. Your diet app doesn't tell you, hey, tomorrow your next meal, you need to be eating X because of Y. Your mindfulness app doesn't tell you that, hey, it'll give you a stress meeting, blah, blah. It'll give you nice fancy dashboards, right? But it's not telling you, hey, tomorrow or today, it's sunny, walk out for 10 minutes. It doesn't give you pointed guidance. The sleep app At the most, it'll tell you go to sleep at 9:30 tonight. You're like, yeah, big deal. I mean, it doesn't give you a sleep pattern that would work for you, where it connects across nutrition, activity, mind, which says, okay, you know what? We got to get you off caffeine after 2 o'clock, blah, blah, blah. Like it doesn't give you a plan, that, hey, here, listen to this music, listen to this audiobook, whatever. It doesn't guide you on forward-looking steps, largely,
Okay, I'm
right? More and
following.
more players have now started doing it. But, so what we do is we provide holistic, personalized, dynamic guidance on forward-looking actions that would make a difference to your health, right? So we give
And
you
does it
tools.
have these inputs as well? Like the watch and does it have those inputs?
Yeah,
And it,
exactly. I mean, it's on an app. So we have a Live 150, we have a Live 150 app. But the beauty is, I don't know if this is gonna show, but
yeah, it's getting
I should
blurred out.
let me unblur my background, I guess. Let me see if this works. Yeah, there you go. So here's our app, and right on the app, you can't really see, but you can download Live 150
Sure.
on the iPhone store or on Google Play, and you'll be able to see it. But you get all sorts of things. It connects with all your devices. It gives you scores. It tells you forward-looking action, and it's a holistic app. So getting into good health is not just about addressing one thing, right? So Peloton, for example, just addresses your activity. All these things are interconnected. So what I eat is connected with the amount of activity I do. What I eat is connected with about the amount of sleep I do, or even
Yeah.
your activity
Yeah. Oh,
is connected with your
100%.
sleep, right? So
100%.
nobody does holistic.
Nobody does
We
that. Yeah,
all,
that's so true.
you know,
That's
there
so
you go.
true.
So
Yeah.
nobody, like you look at the big Apples, Google, nobody is giving you pointed, personalized, holistic, and dynamic guidance because our lives are dynamic. It's not static. I can go pay $200 for an hour session from a nutritionist, and she'll
Mhm.
give me a health plan which is static or a nutrition plan which is static. And guess what? I walk out and I grab a packet of chips. It's not on my nutrition plan. And then the plan doesn't adjust, right? So it's a static plan. So if I walk one day versus I run next day, if I have a bag of chips or I have a glass of, my plans should dynamically adjust. So not only are we personalize to Sunny. So for example, in my case, it personalizes to me. It knows I'm South Asian. It knows I love Indian food. It knows I'm vegetarian, blah, blah, blah. So it gives me pointed guidance. It knows the cuisines I like. And it starts giving me pointed guidance on nutrition, starts giving me pointed guidance on activity. Because even on activity, I can tell you, oh, you know what? Maybe you should go row. Well, guess what? If you don't row every day and all you do is walk and run, if I tell you to go row, the probability of you being able to do it is highly remote. And then you
Right.
fall off,
Yeah.
right? So it's got to adhere to what you do. Behavioral change has to be incremental things which you already do. So if
But
I
it
can
can give us
instead build
suggestions
a
as
plan,
well, though. Like, I mean, weight training, for example, in my view, is
absolutely,
like
it'll actually give
insanely
you
beneficial, or like sauna, hot sauna. There's all these like crazy hacks where
exactly.
they affects all cause morbidity and but
Yes.
this is a huge, massive idea, Rahul, and your enthusiasm about it is contagious. So, hey, Rahul, I didn't even realize how fast the time kind of went by. I like to keep these episodes. I used to do like 90-minute sessions, and now I try and keep them to 30 to 40 minutes because
Sure.
people's attention spans are nowadays like 10 seconds or whatever. So it's hard to keep people. But I would love to do a follow-up. I don't even think I touched 5% of my questions that I
Oh
had
my
prepared
God.
for you. You're a fascinating person, but maybe help me land the plane a little bit in terms of the website, do you blog or tweet? Like, how do people plug into your consciousness and follow the great work that you're doing?
Yeah, so we are on live150.ai. So you can download the app, and then we are also unique because we have an entire WhatsApp experience. And people can reach out to me, rahul.mehendale at live150.ai.
Cool.
Uh, Very responsive. I mean, on our app, you can ask questions, you can interact with the community. We are going to solve health together. This is
Mm.
not just an individual. We use research. So we have 100 and whatever 300, we have 13 million medical articles in real time that get mined, right? So this is not just an open boil the ocean LLM, right? We have all these different articles. We mine these every day. So there's a research layer, and then there's an evidence-based layer because every person on the on the app, we see what's happening with their health. So we actually collect evidence and then we turn it around and disseminate it for within people like you, right? So then that has an important mechanism. So people can connect with me, they can write to me. We are on Instagram, LinkedIn, Facebook, you name it. We're on every channel that there is. You can drop me an email, you can download our app, and the whole experience is on WhatsApp. So I can actually speak to it and I
That's
can say,
so cool.
hey, I'm on an airplane. What should I do? And then it'll figure out that, I can't run around. I can't do push-ups on an airplane. So it'll give me seated exercises, right? So it really personalizes. I can say, yeah, I've never had Nigerian food. What should I go eat there? It'll tell me exactly what would work best from a Nigerian menu, which is vegetarian, that would work for me, so on and so forth. So again, this is personalized, hyper personalized guidance that we provide, and that you can engage with it on the app and reach out to me anytime.
Very interesting. So maybe just hang back for a minute or two. I'll bring this video to or this interview to a close. Rahul, once again, very, very, very interesting, and yeah, it really hits home in terms of a lot of my personal passions as well. So thank you all for listening, and tune in again soon.